She is a professor at the School of Planning and Architecture, New Delhi. She's an architect by training. She teaches in the Department of Industrial Design, and she pursued a PhD in a reflective methodology at RMIT Melbourne, Australia. I think both her advisors are here, or one advisor is here, and a good friend is here. Uh, Liam Fedesi, her advisor, will speak immediately after her. And Aditi is going to speak about health and design shaping what shapes us.
Okay, thank you so much for inviting us here. We are from the design space. I'm from the design space. We've got Liam here, James here, Parag here as well. I think we are probably the only design people in the room.
My grandmother is a designer. We forgot.
That's true. Yeah, that's true. Yeah, yeah. Uh, so as design people, thank you for accepting us in this space. And there's a whole lot of knowledge in this room. So I'm sure you've had wonderful sessions in the morning. So design is a difficult thing to decipher, like a lot of things are. Designers spend their entire lives trying to decipher what they're doing. So I'm going to show you, basically I'll tell you a few stories. I'm going to show you a few projects that we do, and then maybe we can talk about them later. So my presentation today, I've called it Health by Design, Shaping What Shapes Us. Now health itself, what does it mean? I grappled, so I'm sort of finishing my PhD in a few days, or a couple of months, maybe a few weeks. So at the beginning of my PhD, so I'm an architect and designer by profession, and my PhD is based in the healthcare design space. And I grappled initially with kind of trying to understand what health really meant. Because a general understanding of health is I'm sure a lot of you in the room already understand this, but for me it was new. I had done a few healthcare projects, but kind of understanding whether health and illness are sort of opposite, polar opposite. There's a dichotomy in understanding whether they are completely different or there's a little bit of one in the other. Consumed me for the initial phase of my research a lot. They are sort of positioned as binary opposites, I mean polar opposites. And I would say that's really simplifying a very complex phenomena. So I suppose in health there is always a little bit of illness, and in illness there is a bit of health, and these are terminologies. It's important to understand. It was important, I'm sure a lot of you already understand that. It was important for me to understand that these things are quite complex in their vocabulary, but we use vocabulary, and vocabulary matters uh, uh, in quite a sort of easy manner. So in design, this tension actually between health and illness opens up a lot of space to do things. So you don't position yourself at opposite ends of the spectrum, but within the spectrum, we develop opportunities to do a lot of things design wise. So we hear this all the time. So in India, so everybody else would know, if you've gained some weight and if you are a little chubby, people will tell you that you are looking healthy, and it's in a good way. They say, "Acha healthy lag rahe ho." Like, it's in a nice way. It's not even derogatory. So it's a good thing. And on the other hand, if you've lost weight and you're lean, people will tell you you're looking a little weak. So it was sort of considered a nice thing to be a little round, to be sort of looking a little more prosperous than you should. And all of that, there's a lot of variety of understanding that exists now, because we understand things like BMI, etc. There's a lot of health monitoring, there's quantification, etc. So that has sort of changed the way a lot of us have started questioning this entire premise. I put this slide here for Liam and James because this time they came to India during Holi time. The last time they came, it was Ganpati Visarjan in Mumbai. Is there anybody from Mumbai here? Oh, yeah. Yeah, because Mumbai is crazy. People feel Ganesh ji is such a loved god, an icon. Ganesh ji has a pot belly. The belly is supposed to symbolize the entire world. I mean, it's supposed to symbolize prosperity. the fact that he can digest all evil, he brings good luck, prosperity, etc., to people's homes. And Ganeshji is an icon that sits in all of our houses. Um, this was a holographic impression of Ganeshji during one particular Ganesh Visarjan, which was done by a fitness company called Neutralite. So what they did was, because there are a lot of fitness and enthusiasts, everybody is wearing a band, mapping their steps, quantifying what they do. It was a marketing gimmick, of course, and it was done very intensely. So there are a lot of pandals during Ganesh Visarjan, and one of the pandals was this health or fitness pandal. So Ganeshji was holographic, and the devotees were given a health band, and as they walked and they consumed their steps, Ganeshji kept getting healthier and healthier. Not an image that we can relate to. So semantic plays such an important role in design of how things are perceived and things are looked at. This is in no way Ganeshji we love and admire. It just changes the complete visual of Ganeshji. It was a very aggressive marketing campaign, of course, but I thought it's interesting insight into how complex this phenomena of understanding. Now you have a god that's roly-poly. Pot belly is considered very bad. The doctor says one thing, otherwise you feel perfectly fine. There is no illness in your body, but yet you do not feel fine. So I mean, it's such a complex phenomena, and I kind of explored a lot of that during my PhD work. Though I was working particularly with a hospital, and we were working with evidence-based medicine or allopathy, because it was based out of Australia. Again, thank you. Yeah, I have to say this clearly. So, so health by, so I'm neither a doctor, I don't wear a white robe, I don't prescribe, I don't write medicine, I'm not a public health expert either, a policy maker, a social worker. I'm none of these. All of you practice one of the other. I'm not a traditional health practitioner either. I don't work in an hospital or a health department, wellness program. So I don't know if I'm fit to talk to you about this today, but I do design. And design by health is kind of about, if I had to sort of really simplify it, it's about people, it's about creating objects and exploring possibilities. So design kind of operates at many levels. Sometimes designers are looking at finding particular solutions to things, and other times they are swimming within opportunities or looking for opportunities, creating ways to do things, maybe just crafting new interventions, shaping different experiences. So there is like a plethora of things that designers do, and within that I thought I'll share a few projects with you today. So I've classified them into 5 categories. I mean, this is by no means an exhaustive classification. There can be so many ways of looking at this. But designers often try to bring about some kind of change in a variety of ways by the things that they do. Some of them are quantifiable, some of them aren't, some of them are based on experience, some of them are tangible, some of them are intangible. They're systems and services, etc. So I'll show you a couple of projects to do with behavior, to do with things that are based out of community, are common within us, about culture, about technology, and about care. So I'll just show you a couple of projects that we worked at. So a lot of design, we believe, and it has been shown, can trigger sort of behavior change in habits. You can look at societal well-being by sort of conducting research and framing your design propositions. I was part of a really interesting and fulfilling co-design exercise. This was when I worked in an architectural firm, and we were asked, this image is AI generated. I generated it yesterday because for the life of me, I could not find these photographs. They're more than 13 years old. I could not find these pictures. But we were working in the south of India, close to Hyderabad, and there was an industry. And the industry mainly employed women. And these women worked in sort of leather manufacturing, if I remember correctly. So they were developing a housing for the women. And we were required to understand or create a brief for what housing for them would look like. So after a lot of deliberation, because there are set standards for creating housing, we did a co-design exercise with them. So we literally created small architectural models. So we created models of kitchens, bathrooms, bedrooms, etc. And we sort of laid it out for them to play with. So we said, suggest your configuration, and we had a couple of workshops with them. And what came out was actually very interesting. These women were employed all day long, and in the evening, they barely got any time to spend with their children. So they said a lot of women started placing the kitchen close to the common playground. And we were wondering why they're doing that, because the kitchen usually wants to look at the front entry of the house, because the woman of the house needs to know who's coming in, who's going out. But a lot of them said, so we asked them, why do you do this? So they said, because I get to spend such little time with my kids that it's so nice that I can see them play while I'm cooking. And that was like an amazing insight, because you take that and the complete configuration of what you do changes. And I think that's what well-being is about. I mean, I think there was a conversation about de-stressing yourself mentally, your mental state, and what that leads to. This was one such exercise. This was a project we did on the border of Haryana and Rajasthan. This was commissioned to us by one company, again based out of Kerala. They had a funding from the Gates Foundation, and they wanted interventions in women hygiene, especially to do with a girl child in schools. So we designed for them some women urinals. This was done, a lot of study was done for this, because statistics kind of showed that girls would typically avoid school, especially during the menstrual cycles, which was astounding, the kind of statistics that existed. So we said, if you can improve the condition of the washrooms, more girls will come to school. And there was a lot of research that was done to sort of figure out this shape. This was cast in one piece, it was built, tested, etc. I call this commons by design, meaning a lot of responsibility that exists in our cities is kind of shared by all of us. I think most of us, if you live in Delhi, you have an RO purifier in the house, and you feel guilty every time you're wasting water or you try and recycle the water. But that water is even more contaminated, and everything is leached out of your water. So what is the collective responsibility? As an answer to that, we developed a project where we created like water quality indicators at a community level that would be sort of placed in prominent locations. So like at a chalk or at a intersection, and the quality of the water line would be attached to it. So the water would kind of pass through this transparent loop, and there was a sensor. If the TDS went above a certain level, the sensor would change color. So at a community level, you knew that the water was unfit to drinking, and so would the municipal authorities, because water pipes are essentially buried under the ground. And most of us are purifying our water where the water is mostly potable and fine to drink. So this was an intervention to sort of get everybody involved in the process and get them thinking about what is collectively owed to us. This was a first aid booth that we had created. Today is 38 degrees. We often have cases of heat exhaustion, heat stroke, etc. in the city. A lot of the work we do is to also impact policy making, so that policy makers sort of wake up and try and this is a way of kind of understanding what we need as a community and how we can make those proposals. So first aid booths that could be set in prominent locations in the city, much like the medical ones that we have. This was a project that was commissioned to us by Kohler. Kohler is a sort of, they call themselves a luxury sanitary ware brand. It's an American brand, and they just come to India, and India is a huge market. So Kohler wanted to understand the Indian market. So this project is about semantic and how things look. Indians wash their hands before eating, and we always struggle with finding a wash basin. So this was, and often people, this is an architect's nightmare, people put wash basins in their dining areas, which can be quite unsightly, unhygienic, etc. So we sort of re-looked at how a wash basin could look, and we designed something like this. I'm going fast, I'm at 19 minutes. Then technology plays a big role in what we do, and sometimes we use technology, directly apply technology with the human angle in perspective. So this project we've just recently been granted a patent for. We've been working on this since 2019. This is a portable diagnostic kit for pulmonary tuberculosis. Tuberculosis, because it shows initial symptoms of a flu-like symptom, often it's ignored, and it sort of precipitates into something much larger if it isn't addressed at the right time. So we designed something to be used in the current scenario, which is a set of semi-skilled people and a lack of electricity. So it is sort of human powered. It uses the phone of the ASHA worker. We created a working model of this. It uses the phone of the ASHA worker as its interface, and it uses a process. It's a complicated process that's simplified to a great extent to take the test to the lab. Then a lot of what we do in design is also to do with simply care. We do projects where sometimes you just support the well-being of somebody going through a medical procedure. So this project was designed in collaboration with a hospital, and we were looking at small children who get cancer, and they have to go through the entire process of chemotherapy, etc. So our research showed us that if children are made to understand what they are going through and they comply with the process, the results are better. So this was sort of gamifying it. Some of these are red blood cells, some of them are WBCs, and it's gamified to understand that what the process you are going through is actually making you feel better. So what I said about prototypes, so we created a few models, etc., tested them, and they were very well accepted. The last project that I want to share with you, this is a really good one. And here again, like I was saying, we question the policies that are framed. So there are certain policies for, this is an incubator for children. So there are very high-end regulations for incubators of what they are supposed to do, the specifications they are supposed to follow, etc. But they are so complex that they are very difficult to understand by the staff that's working on the ground. So after our research sort of showed us that mostly they resort to even sometimes kind of putting it off for a while, restarting it, etc. because of the complexity. We kind of simplified it to a great extent, the interface. And also electricity is, though we have the sun, but electricity that flows in our wires goes on and off. So that makes the object completely redundant. So we converted it to battery power, and we created a prototype of this as well. So that's it. I've taken 23 minutes. That's it. So I just wanted to kind of share a little bit about what we do and how we try and contribute to the health and well-being space. Thank you.
Irosa has described various varieties of toys for children.
Okay.
You can take into consideration, you can design according to Ayurveda, and one can study throughout the world.
Okay, that's really, actually I wasn't aware of that. That's a very interesting thing. I'll definitely look it up. Thank you.
I can give you the references.
Okay, that will be great.
Sort of toys
Yeah.
to be handled by the children.
That's really interesting, because there's very little we find in written literature about toys. There are only a couple of books about design of traditional toys as well in India. Just 2-3 books, I think. So it'll be really nice to have the references.
So that one can study which tool the child selects, probably what will be the child in future. So they have thought in that way also.
Okay.
Apart from amusing the child,
Yes.
the future study,
Yes.
Why they can study.
Yes, keeping the child busy for just a little duration versus, yes, absolutely. And considering it's evolved over centuries, I'm sure it'll be amazing.
What he's trying to say,
Yeah,
which toy the child is picking,
yeah,
depending
has a psychological.
Psychological and maybe something achintya which we cannot
Yeah.
think in the logical situation.
Yeah.
It can become in the near future or
Future.
very future.
Okay, that's amazing. I'll get those references from you. Thank you.
Go ahead. Please go ahead.
When we enter into a hospital,
Can you get a little louder?
I could hear.
gloomy kind of an atmosphere, disease, virus, and all that kind of an patients and all these.
Yeah.
If you work on anything, I mean, you said the title,
Yeah.
helping health,
Yeah.
shaping us and reshape that.
Yeah.
Have you done any kind of this kind of a project where, I mean, when you enter into a service center,
Yeah.
health facility,
Yeah.
it should look a little happy,
Yeah.
good feel,
Yeah.
and colors are like that, or
Yeah.
designs are like that.
Yeah.
This one is
A lot of work is done in that. In fact, all the private hospitals pay a lot of money to designers and architects to do exactly that kind of a work. And in fact, the contention of my PhD was that are we emphasizing too much on that kind of a work, and what really does a patient go through? So the niggles that a patient faces. I mean, I'd rather have a hospital I don't want to go to because I'll keep myself healthy. I don't want to go to the hospital. I avoid taking any medication of any kind as long as it's not a extremely threatening condition. So yeah, there's that school of thought. But a lot of private hospitals spend a lot of money on.
the government ones only.
Yeah, the government
Where
ones.
Normal people, the common
Yeah.
people in the
Yeah.
rural area, they just go.
Yeah. In fact, we are working on, we are not working on beautifications of hospital as such, we are working on sort of simplifying and smoothening operations within a hospital so that you're in and out as fast and as efficiently as possible. So that the time, because the volumes of people that are, I mean, we are all very critical of primary healthcare centers, etc. But if you look at the volumes of people the doctor caters to, and also the speed at which they do their diagnosis, it's absolutely phenomenal. So yes, we do a work on improving sort of efficiency. But yeah, there's like two ends of the spectrum: the private hospitals and the government hospitals in the country. Absolutely.
Very interesting question you had asked. But in Australia, Liam and James will.
The children's
be able
hospital.
to Tell us more. There's a children's hospital. It's a government Royal Children's Hospital, and they wanted to revamp the whole thing. So they not only made the hospital friendly, children friendly, but the whole environment around it. The moment there's a tram which comes to the children's hospital. So, 2 stations before the main tram station, there are these cutouts of animals, which are like one of the animals' hand is fractured, somebody's leg is fractured, and they are putting this bandage and all, and they're very happy. So the concept of the hospital, what you rightly said, is that children are happy to come to hospital. There's a playground, there's a very big aquarium, there is like a small zoo inside the. So children come in and they just roam around and they're happy to go to the hospital. So they've done it. But I think in India we have like.
No, I can give one example of India. This is where I want to go. Can you please be louder? One example of India, because he has quoted something about India. So we were working at 200-bedded COVID hospital, and as she said that we have to consider a lot of things, but we don't have architect at rural hospitals. And we were given the responsibility to convert 200-bedded hostel of underprivileged children to a 200-bedded hospital.
Wow.
And out of those 200-bedded hospital, 24 to 30 beds were given for the ICU. Now we had one big kitchen, or you can say the serving area, and there was a connection of the water. So what we planned, it was planned by the doctor,
Yeah.
because we did not have architect as a
Absolutely.
So we brought that area in the center where the water supply was there, and we converted that area into urinal, which is the basic requirement
Yeah,
of the ICU
totally.
patient. Second thing, ICU means we think of the AC. ICU is equal to AC in India for most of the ICUs.
okay.
And for COVID, we thought, this was the Ayurveda concept, that cold air is not good because the lungs are already striving hard. So we removed the air conditioning part, the cold air conditioning part of it, and ventilation was given to the patient. And third thing, as I told you, the beds were designed in a way that the sicker or the sickest patient will be very near to the bathroom. Because in COVID, you may have excess staff, or if the staff become positive, the patient themselves have to go to do. So in this way, you were talking about design. So even doctors can think about
Absolutely.
it, and
Absolutely.
with integration definitely it will help better. But these were few things which the patient while discharging they said, ma'am, this thing was really helpful. I mean, apart from the treatment and other things what you select, this thing, the ventilation part, and then again another thing added is that we allowed the relatives to come inside. So the psychological pressure that I am alone was taken care. I am with someone. So this is about design. Thank you.
That's amazing. I think Parag might talk about a very similar thing tomorrow. The idea, of course, the doctor is the specialist, and I think under that condition of duress that happened during COVID, one didn't have time to think, and they took on the role of an architect / designer / whoever would do that, and they probably used their expertise that they had to sort of deploy the best possible solution. And this is actually an ideal condition. I mean, if we could all do this, that's phenomenal actually.
Ayurveda has advised to consult a Vastuvidya Visharada while consulting Rugnalaya, Kumaragara, Bhishajagara, and Sutikagara, etc., where Varchasthan and Mutrasthan are to be separated like that. So,
It's logical.
These designers can consult some Ayurvedic text and then they can integrate in future.
Yeah, and actually a lot of it is quite logical. I mean, you would want to keep these two entities away from each other. Yeah, absolutely.
Thank you so
Karu.
much. Thank you, Aditi. Let's all
Thank
thank
you.
Aditi for a
Thank you.